Welcome to the Health Talks podcast. Today, we're joined by our co-hosts, Mr. David Jones and Ms. Jessica Brown. Our today's podcast topic is Human Immunodeficiency Virus, HIV, an in-depth examination.
All right, diving right in today, we're tackling a topic that I think a lot of folks might think they've got a handle on, but trust me, this deep dive into HIV, it's going to surprise you, even if you think you know the basics. We've got this dense article, and it goes way beyond, the HIV 101 stuff.
Yeah, you're right. I mean, HIV's story, it's so much bigger than just the virus itself. We're talking global health, research, even how we see each other as a society,
Exactly. So whether you're here for a quick meeting prep or just because you find this stuff fascinating, stick with us. One of the first things that kind of caught my eye in this article was how HIV is structured. They called it an enveloped virus. I don't know, maybe it's just me, but that sounds kind of sinister. What does that even mean? And why should we care about that detail?
It's a great question, and it actually helps us understand how HIV operates. So picture this, right? You've got this tiny microscopic package. That's the HIV virus. Now imagine it's wearing a coat, a disguise, and that coat is actually stolen from the very cells it infects. That's the envelope. And this stolen disguise, it's how HIV gets past our body's defenses and sneaks into our immune cells.
Wow, sneaky is right. So if it's basically camouflaged, I'm guessing that makes it a lot harder to develop a vaccine for HIV. If it's constantly changing its code, it's like our immune system can't really get a good lock on it, right?
Exactly. That constant evolution, it's like HIV's secret weapon. It's why creating a vaccine that provides lasting immunity has been such a challenge.
Makes sense. Now, we all probably know the basics of how HIV is transmitted, but this article really dives into some of the myths and misconceptions that are still out there. And it even shared this story about someone facing really intense stigma just because people didn't get the facts straight. It's heartbreaking how misinformation can impact people's lives.
Absolutely. And that's why we got to keep busting those myths. HIV is transmitted through specific body fluids. We're talking blood, semen, vaginal and rectal fluids, and breast milk. And the main ways this happens are through unprotected sex and sharing needles. Oh, and also, it can be passed from mother to child during pregnancy, childbirth, or breastfeeding.
Right, so those are the facts. But, and I think this is super important to emphasize, how HIV is not transmitted is just as crucial. You can't get it from casual contact, hugging, kissing, sharing utensils, even using the same toilet.
Exactly. We got to keep repeating this. This isn't just about getting the science right. It's about fighting the stigma that makes life so much harder for people living with HIV.
Okay, so we've talked transmission. Now let's talk about the stages of HIV infection. I think it's helpful to think of it as this journey through time rather than, just one static condition.
Yeah, I like that. It's a dynamic process for sure. And each stage has its own implications, not just for someone's health, but for how we understand the virus and its impact on society as a whole.
Right. So let's imagine someone's just been exposed to HIV. For the first few weeks, they might not even notice anything. Maybe they feel a bit off, like they have a bad flu, fatigue, maybe a fever, a rash, that sort of thing. This is what's called the acute stage. And this is when
the virus is replicating like crazy. That means there's a ton of HIV in their blood, making transmission more likely, especially since they might not even know they're infected.
Right. You wouldn't necessarily jump to HIV if you just felt a little under the weather. So then what happens after that initial stage?
Well, things get a bit quieter. The acute phase transitions into what's called the chronic stage, sometimes also called clinical latency. This can last for years. We're talking a decade or even longer, and often with very few, if any, symptoms.
So someone could be living with HIV and not even realize it?
It's possible, yeah. And that's why regular testing is so important. Because during this chronic stage, even though things seem calm on the surface, the virus is still doing its thing. It's quietly weakening the immune system. And this silent progression, it has huge implications for transmission, because people might unknowingly be spreading the virus if they don't know their status.
And this brings us to the topic of testing and something called the window period, which the article mentioned. Can you explain what that is and why it matters?
Sure. The window period is the time between when someone is exposed to HIV and when a test can reliably pick it up. It takes a while for the body to produce enough antibodies for the standard test to detect it.
So you could potentially test negative right after a possible exposure, but still actually be infected. That seems like a recipe for false reassurance, especially if you don't understand this whole window period thing.
Exactly. That's why it's key to understand the different types of tests out there and what their limitations are. We've got antibody tests, which are pretty common, often used for rapid testing. Then there are antigen antibody tests, which are even more sensitive. And if you need really early detection or to confirm a diagnosis, there are nucleic acid tests that actually look for the virus's genetic material.
Okay, that's a lot of technical stuff. But the bottom line is, knowing which test is right for you and when to get tested is crucial, right? I'm assuming healthcare providers are talking to their patients about this all the time.
They definitely should be. Knowing your status is paramount, not just for your own health, but to prevent passing it on to others.
Absolutely. And that leads us to treatment. The article really highlights antiretroviral therapy, or RT, as a total game changer. What makes this treatment so significant?
Well, RT has completely revolutionized the way we approach HIV. It's a combination of medications that essentially stops the virus from replicating. It suppresses it. Now, ART doesn't eliminate HIV from the body completely, but it can reduce what we call the viral load to undetectable levels.
Undetectable, does that mean like the virus is basically invisible to tests?
Yeah, you got it. But more importantly, it means the virus can't be transmitted to others. That's the huge takeaway here. People on RT with an undetectable viral load, they can have relationships, have kids without passing the virus on, and live near normal lifespans. It's had a massive impact, not just on individual health, but on how society views HIV.
That's incredible. So ART has essentially shifted HIV from a death sentence to something manageable, like a chronic condition you can live with.
You can say that, yes, but there's catch, and it's a big one. The key to RT's success is adherence. That means taking those meds exactly as prescribed every single day.
What happens if you miss doses or don't take it consistently?
Well, if you're not sticking to the regimen, the virus can start replicating again, and that means your viral load goes up. And worse, inconsistent adherence can lead to what's called drug resistance. The virus can actually mutate, making the meds less effective. And drug resistance, it's a major challenge. Not just for the individual, but for the global effort to control HIV as a whole.
So taking those meds regularly, it's a must for your own health and for the bigger picture. But the article also mentioned that sticking to a strict medication schedule, it can be tough for a lot of folks. What are some of the reasons why people struggle with that?
Yeah, it's not always simple. Sometimes it's side effects of the meds, sometimes people just forget. But a lot of times it's tied to these bigger social and economic issues. Can they access healthcare easily? Do they have stable housing, enough food? And even just the stigma around HIV can play a role. It's complex and it goes way beyond just taking a pill.
It's that reminder that healthcare isn't just about pills, right? It's about a person's whole life situation.
Exactly. The whole picture.
All right, let's shift gears a bit to another big piece of the puzzle, prevention. What does the article have to say about ways to protect ourselves and others?
Well, the good news is we've got options. A whole range of them. And understanding these options can really empower people to make smart choices about their health.
I'd say most people probably know about condoms, right? That's like the classic prevention method.
Condoms are definitely up there. They're super effective at preventing HIV transmission. But the key is using them consistently and correctly.
Right. Gotta use them right every time. And then there's PPIEP and PP, which I'll admit I always get those two mixed up.
It happens. They do sound alike.
Sorry.
Okay, so PPP, that stands for pre-exposure prophylaxis. It's a daily pill that helps prevent HIV infection in people who are at higher risk of exposure. Think of it like
if you know you might be exposed to the virus through your job or your personal life, PPIEP adds an extra layer of protection.
Exactly. Like taking a daily vitamin to avoid getting sick. Now, PP, post-exposure prophylaxis, that's taken after a potential exposure to HIV.
Like, say, if someone has a needle stick injury or was possibly exposed during sex.
Right. But there's a time limit. It has to be started within 72 hours of that potential exposure to be effective.
So if you think you've been exposed, don't wait, right? Get medical help fast.
Exactly. Quick action can be a game changer in those situations.
Okay, all of that makes sense. But what about people who inject drugs? That's a tough situation. There's so much stigma surrounding it. What are some of the prevention strategies for that population?
Well, the article talks a lot about harm reduction strategies, which are really crucial in this context. We're talking needle exchange programs where people can get clean needles and syringes. That's a big one for preventing HIV transmission.
And it's not about judging people, right? It's about meeting them where they're at and offering support without, demanding they change their whole life overnight.
Exactly. Harm reduction acknowledges that people use drugs for a bunch of different reasons. Demanding they just stop isn't always realistic or effective. It's about reducing the harms that come with drug use. And that definitely includes preventing HIV transmission.
Okay, so we've talked a lot about the science. We've covered transmission, the stages of infection, treatment, even prevention strategies. But I think we need to also talk about the human side of HIV, the experience of actually living with the virus, which often gets lost in all the technical stuff.
100%. We need to shift our focus to the lived experience of people with HIV beyond just the medical facts. It's a human story, after all.
The article talked about the importance of mental health support and community resources. Why are those so vital for people living with HIV?
Well, for starters, living with HIV can be tough, really tough, physically and emotionally. You've got the stigma, the fear of telling people, side effects from the medications, needing ongoing medical care. It all adds up.
And I can only imagine the fear of discrimination that hangs over people, right? Worrying about losing their job or their home, their relationships. That has to be a constant weight.
It absolutely is.
Yeah.
And that's exactly why mental health support and community resources are so essential. Having a strong support system through therapy, support groups, connecting with others who get it, it makes a world of difference.
It's about belonging, right? Knowing you're not alone in all of this.
Exactly, because at the end of the day, it's about helping people with HIV not just survive, but thrive.
Well said. All right, let's zoom out for a minute and look at the bigger picture. What's the global impact of HIV? The article mentioned some pretty impactful statistics about how it's affecting the world.
Yeah, the numbers can be overwhelming for sure. We're talking millions of people globally living with HIV. And the epidemic, it's still hitting some regions and populations way harder than others. It's not evenly distributed, that's for sure.
It's a reminder that HIV isn't just a personal health issue, it's a global crisis. But the article also mentioned some positive trends, right? Like, haven't we made some real progress in reducing new infections and deaths related to HIV?
Absolutely. There's been some serious progress in recent decades, largely because of advances in treatment, prevention strategies like ART and pre-EP, but there are still huge barriers to accessing those life-saving resources in many parts of the world, especially low-income countries where resources are limited and healthcare systems are struggling.
So it's a story of progress, but also a story of persistent inequality.
Yeah, I think that's a good way to put it. And it shows us why we need continued investment in research, funding, and global health initiatives. We've got to make sure everyone has access to HIV prevention, testing, and treatment. It shouldn't matter where you live or how much money you have.
Right. Access to healthcare is critical, but so is education and awareness, wouldn't you say? We have to dismantle stigma, push back against misinformation, and arm people with the facts about HIV.
Totally agree. Knowledge is power. And by debunking those myths and sharing accurate information, we can make a real difference in fighting the epidemic.
So where are we headed in this fight against HIV? Is there a cure or a vaccine on the horizon? I know that's something a lot of people are wondering about.
The big question, right? Well, the article touched on some exciting new research. Scientists are exploring some really promising avenues. There's vaccine research and some really cool stuff happening with gene editing techniques.
Gene editing, that's the tech that's been in the news lately, right? For its potential to cure genetic diseases. I remember reading about CRISPR. Didn't realize they were using it in HIV research, too.
CRISPR, yeah, it's a game changer for sure. A revolutionary gene editing tool. Researchers are trying to figure out how to use it to either completely eliminate HIV from the body or tweak the immune system so it can control the virus without needing lifelong medication.
Wow. That sounds almost too good to be true. So how would CRISPR actually work to cure HIV? Can you walk us through the science a little bit?
Sure. There are a couple of different strategies being tested right now. One is using CRISPR to target and cut out the HIV DNA that's integrated into the host cell's genome.
So basically snipping out the viral DNA like it's nothing.
Basically, yeah. If it works, it could effectively erase the virus from the body. Another approach is modifying immune cells, specifically T cells, to make them resistant to HIV.
So engineering like super-powered immune cells that can fight off the virus.
That's the idea. By changing specific genes in the T cells, scientists hope to either make them completely immune to HIV or boost their ability to kill infected cells.
These are some seriously cutting-edge approaches, but I have to ask, are there any risks or downsides with this CRISPR gene editing? It almost sounds too good to be true.
There are definitely challenges, both on the scientific side
And we're going to dive into those challenges and explore the potential of CRISPR even more in part 2. So stick around, we've got a lot more to unpack.
Well, yeah, I mean, Like I was saying, the potential of CRISPR is huge, but it's not a magic bullet. One of the biggest challenges on the science side is making sure the gene editing is super precise. Like, we don't want to accidentally cause any unintended changes to the genome, right? Got to avoid those off-target edits. They could have, like, really unpredictable consequences down the line. Accuracy is key, but so is safety.
It's like you're performing surgery, but on this like tiny molecular level. One wrong snip could mess things up in ways we can't even anticipate.
Exactly. And even if we clear those scientific hurdles, there are bigger questions to think about, especially with something as revolutionary as a potential cure for HIV. Like, how do we make sure everyone has access to a CRISPR-based therapy? Can't just be for the rich or people in certain countries.
That's such an important point. We've seen this happen with other life-saving treatments, right? Where cost or lack of access to healthcare kept them out of reach for so many people. We can't let that happen again.
Absolutely. We got to be thinking about these issues now, before these therapies are even widely available.
Yeah.
We need to make sure that everyone, rich or poor, no matter where they live, has a chance to benefit from these advances.
It really highlights how scientific progress can't just happen in a bubble, right? We have to consider the social and ethical side of these breakthroughs and make sure they benefit everyone, not just a select few.
Couldn't agree more. And it's not just about access either. It's about informed consent. How do we make sure people understand the risks and the benefits of CRISPR before they sign up for treatment? I mean, it's a powerful technology, but it's not risk-free. People need all the information to make informed choices about their own health.
It sounds like the science is racing ahead, but maybe the ethical and social frameworks for how to use it responsibly are lagging behind a bit. Makes these conversations even more important, I think.
For sure. We got to be proactive, not reactive. We need to think ahead about the potential problems and come up with solutions that put fairness, justice, and the well-being of all people first.
So yeah, lots of promise with CRISPR for maybe curing HIV one day, but we got to be smart about it, proceed with caution, and make sure our ethics are keeping pace.
Finding that right balance between scientific progress and social responsibility, that's the key.
Okay, so this has been super insightful. We've talked about like the science of HIV, those social factors that affect health, different ways to prevent it, and even this quest for a cure. But there's one piece I think we haven't fully explored yet, and that's the human side of all of this, the emotional and social impacts of living with HIV. I know the article touched on the importance of things like mental health support and community resources, but can you talk a bit more about that? Why are those so crucial for people with HIV?
Of course, living with HIV, it can be a real roller coaster, both physically and emotionally. There's the stigma that still surrounds it, the fear of telling people, the side effects of the medications, and the need for constant medical care. It all takes a toll. It can be really draining.
Yeah, and you add to that the very real fear of discrimination, worrying about losing your job, your home, your relationships. That's got to be incredibly stressful and anxiety-provoking.
You're right, it is. And it just goes to show that HIV isn't just a medical condition, it's a social justice issue. The stigma and discrimination that still exist, they're rooted in fear and ignorance and prejudice. And those attitudes, they have real consequences for people living with HIV.
So how do we combat those harmful attitudes and make things more supportive and inclusive for people living with HIV? Where do we even begin?
Well, I think education's a good starting point. We need to be willing to examine our own biases, learn more ourselves, and share accurate information with others. And we have to advocate for policies and practices that promote equality and justice.
So it's about individual actions and also systemic change, working on both levels.
Exactly. We can all do our part in building a better and more supportive society for folks living with HIV. We can talk to our family and friends, correct misinformation online, call out discriminatory language when we see it. Those might seem like small things, but they matter.
Right. And then, like, zooming out a bit, we can push for bigger changes, too. Policies that protect people with HIV, ensure access to affordable health care and housing, and address those deeper social and economic factors that lead to vulnerability and stigma in the first place.
That's the big picture stuff, for sure. And it's all about creating a society where everyone has a chance to thrive, regardless of their health status.
Okay, I want to shift gears a bit to something the article brought up that really got me thinking. What if a vaccine for HIV was developed tomorrow? It made me realize that even with this amazing breakthrough, there's still so much work to do on the social and structural level for it to truly have an impact. What are your thoughts on that?
That's a really interesting point. It's easy to get excited about the scientific progress, but we can't forget that it doesn't happen in a vacuum.
Yeah.
We need those social and structural changes, too, if we want these advances to make a real difference in people's lives.
So let's imagine for a second that, boom, we have this incredible, highly effective HIV vaccine ready to go tomorrow. What are some of the things we'd need to change as a society for it to actually put a dent in this epidemic?
Well, the first thing that comes to mind is access. We've got to make sure everyone can get the vaccine. It can't just be for the wealthy or those in certain countries. We need to make sure that everyone, regardless of income, insurance, where they live, has the opportunity to get vaccinated.
So we're talking about global access, which means thinking beyond our own borders, right? Investing in healthcare infrastructure, distribution systems in countries around the world.
You got it. And it's not just about the physical stuff either. We need trained healthcare workers, education campaigns to spread the word about the vaccine, and systems in place to keep track of who's been vaccinated and who still needs it. It's a huge undertaking.
Logistically, yeah, that sounds like a massive effort.
It is, but we've done it before with other big vaccination campaigns. It's definitely doable, but it takes political will, funding, and cooperation on a global scale.
And we can't forget about trust, right? People need to trust the vaccine itself, trust the healthcare system, trust the information they're getting. We've seen how misinformation and distrust can derail public health efforts.
Trust is everything. You're absolutely right. And building that trust, especially in communities that have been marginalized or mistreated by the healthcare system, it takes time and real effort. We need to acknowledge the mistakes of the past, listen to people's concerns, and engage with communities in a way that's sensitive and respectful of their cultures and experiences.
It's not just about creating the vaccine in a lab. It's about building those relationships and fostering trust out in the real world, community by community.
You hit the nail on the head. And it's not a one-time thing either. We've got to keep at it, keep the conversations going, answer new questions as they come up, and be willing to adapt our approach as needed. It's an ongoing process.
It's that reminder that public health is a marathon, not a sprint, right? It takes constant effort, collaboration, and a real understanding of the communities you're trying to serve.
Well said.
Okay, so we've talked about access, trust, and education. What else needs to change? What other societal shifts might be needed for an HIV vaccine to reach its full potential? Are there other things we should be considering?
You know, one thing that often gets missed in these conversations is the need to address those deeper social and economic problems that make people more vulnerable to HIV in the first place.
What are some examples of those underlying factors?
Things like poverty, limited access to education and healthcare, unstable housing situations, discrimination based on sexual orientation or gender identity. These are all things that can increase a person's risk of getting HIV.
So even with a vaccine, if we don't tackle those root causes, we're still going to see disparities. Some people will benefit while others are left behind.
Exactly. It's like putting a Band-Aid on a much deeper wound. We have to address the systemic issues that create those health inequalities.
So we're talking about investing in social programs, making sure everyone has access to quality education and healthcare, dismantling discriminatory policies and practices. It's a huge task, but it's essential if we want to create a truly equitable and just society.
Couldn't agree more. It's about building a society where everyone has the chance to live a healthy and fulfilling life, free from the threat of HIV and other preventable diseases.
And recognizing that health is about more than just individual choices or medical treatments. It's connected to everything, our social, economic, and political realities.
100%. If we really want to end the HIV epidemic, we need more than just a scientific breakthrough. We need a societal transformation.
Okay, I want to talk a bit about those research efforts to actually find a cure for HIV. The article mentions some promising avenues, especially in the field of gene editing. Can you tell us more about that?
Sure. One of the most exciting areas of research right now is in gene editing, particularly with this technology called CRISPR.
CRISPR, yeah. That's the one that's been making headlines, right? For potentially curing genetic diseases.
That's the one. CRISPR is a revolutionary tool that basically allows scientists to target and change DNA sequences with incredible precision. And researchers are looking at ways to use it to either completely wipe out HIV from the body or to reprogram the immune system so it can control the virus without the need for medication forever.
That sounds straight out of sci-fi. So how would CRISPR actually cure HIV? Break down the science for us.
So there are a few different approaches they're testing. One is to use CRISPR to target and cut out the HIV DNA that's integrated into the host cell's genome.
So basically just snipping out that viral DNA like it's nothing.
Pretty much. If it works, it could essentially eliminate the virus completely. Another strategy is to use CRISPR to modify immune cells, the T cells specifically, to make them resistant to infection in the first place.
So like engineering these super-powered immune cells that can fight off the virus.
You got it. By modifying specific genes in those T cells, the hope is to either make them completely immune to HIV or to improve their ability to destroy infected cells.
These are some seriously advanced approaches, but I gotta ask, are there any risks or challenges that come with this CRISPR technology? It almost sounds too good to be true.
There are definitely challenges, scientific challenges, and also.
And we're gonna dig into those challenges and really explore what CRISPR can do in part 3 of our HIV deep dive. And we're back for the final part of our deep dive into HIV. Remember last time we were talking about CRISPR and those gene editing techniques? There's so much potential, but like you were saying, it's not as simple as just flipping a switch and curing HIV, is it?
Nope, not quite that easy. CRISPR is an amazing tool, but it's got its limitations, like anything else. One of the biggest hurdles is making sure that gene editing is super precise. We don't want to accidentally change other parts of the genome, right? Those unintended edits could have some pretty serious consequences down the road. We've got to be super careful and prioritize both accuracy and safety.
So it's not just about targeting the HIV genes, it's about doing it with like pinpoint accuracy so you don't mess up the rest of the DNA. That sounds incredibly tricky.
It is. It's super complex, and that's why scientists are moving cautiously. They're constantly refining those CRISPR techniques, trying to make them as safe and precise as possible. But let's say we get past those scientific challenges. There's still some big ethical questions we've got to grapple with.
What kind of ethical questions come up when we're talking about something as potentially revolutionary as curing HIV with CRISPR?
Well, one of the big ones is access. If a CRISPR-based cure does become a reality, how do we make sure that everyone who needs it can actually get it? It can't just be for the wealthy or those in certain countries. We have to make sure it's available to everyone, regardless of their income, their location, or their social status.
It'd be a tragedy if we made this huge scientific breakthrough, but then failed to make it accessible to everyone who could benefit. So we're back to this idea that scientific progress isn't enough. We need social progress, too.
Exactly. We need both. And besides access, there's also the issue of informed consent. How do we make sure people fully understand the risks and benefits of this kind of gene editing before they agree to treatment? CRISPR is powerful stuff, but it's not without its potential downsides.
Yeah.
We have to make sure people have all the information they need to make informed choices about their own health care.
It's a good reminder that even with all these amazing advances in science, we can't forget about the ethical side of things.
I agree. We can't just forge ahead without thinking about the consequences. These conversations are crucial. We need to be thinking about these issues now before these therapies become widely available.
So while CRISPR has this incredible potential to maybe one day cure HIV, we have to be thoughtful and responsible about how we develop and use it. We have to make sure these advances benefit everyone, not just a select few.
Couldn't have said it better myself. It's about using science to help everyone.
Okay, so we've really gone deep on this topic. We've talked about the virus itself, the social factors that affect health, ways to prevent HIV, the search for a cure. But there's one last piece I want to touch on, the human side of all of this. The emotional and social impact of actually living with HIV.
That's a crucial part of the story for sure. Living with HIV isn't just about managing a medical condition. It's about dealing with complex emotions, facing stigma and discrimination, and finding the strength to keep going, even when things are tough.
The article talked about how important mental health support and community resources are for people with HIV. Can you talk more about that? Why are those so essential?
Well, living with HIV can be incredibly isolating. There's the fear of telling people, the worry about how they'll react, the emotional burden of living with a chronic illness. It all adds up. Mental health support and community resources, they can be a lifeline for folks living with HIV. They offer a safe space to connect with others who understand what you're going through, to process your emotions, and to build a sense of belonging.
It's about creating a support system that goes beyond just the medical stuff, right?
Mm-hmm.
Recognizing that people with HIV need emotional and social support too.
Absolutely. It's about empowering people to live their lives to the fullest, even with the challenges that come with HIV. And community plays such a huge role in that.
This whole deep dive has really got me thinking about what a future without HIV would look like. It's a big question, but I think it's worth asking. What are your thoughts on that? What kind of world would it be?
That's a great question. It's one we should all be thinking about. For me, a world without HIV is a world where everyone has access to the health care they need to stay healthy. It shouldn't matter how much money you have or where you live. Healthcare should be a right, not a privilege.
That's a pretty fundamental shift, right? From a system that often puts profit over people to one that truly values everyone's health and well-being.
You got it. And it goes beyond just healthcare. A world without HIV is a world without the stigma and discrimination that surrounds it. It's a world where people feel safe to be themselves, without fear of judgment or rejection.
It's a world where we prioritize education and prevention, giving people the knowledge they need to make healthy choices.
It's a world where we invest in research and innovation, not just for HIV, but for all the diseases that threaten our health and well-being.
It's a world where we understand that we're all connected. Our health is tied to the health of our planet and to each other.
It's a world where we choose compassion over fear, understanding over ignorance, and unity over division.
That's a beautiful vision, but it also feels like a really challenging one. How do we even begin to move towards such a radical transformation?
I think it starts with each of us. We need to challenge our own biases, educate ourselves and others, and fight for policies and practices that are fair and just. We have to hold our leaders accountable and demand better.
It's about individual actions, but also about working together to create change. Recognizing that we're all in this together and that we all have a role to play in making the world a better place.
I agree, and I think the lessons we've learned from HIV can help guide us. We've seen the power of resilience, the importance of community, the need for compassion and understanding. Those are lessons that can help us face any challenge.
It's a reminder that even in the face of hardship, there's always hope. And that hope is fueled by knowledge, empathy, and that belief that a better world is possible.
That's beautifully put.
Well, I think we've covered a lot of ground today, from the science of HIV to the impact it has on society, from prevention to the search for a cure, from personal stories to a global vision of a world without HIV. It's been quite a journey.
It really has. I hope everyone listening is feeling inspired to learn more, to challenge stigma, and to do their part in creating a healthier and more just world.
I'm sure they are. We've given them a lot to think about. But before we go, I want to leave you with one last thought. What kind of ancestor do you want to be? What kind of legacy do you want to leave behind for future generations? What kind of world do you want to create for your children and grandchildren? Those are questions worth reflecting on.
Those are powerful questions for sure, and I think the answers are within each of us.
Thanks for joining us on this deep dive into the world of HIV. Until next time, stay curious, stay engaged, and keep working towards a brighter tomorrow.